I have not threatenable, if I can use that word. The president, the appointing authority, he has appointed me. I am now being vetted. If I am cleared by the committee of parliament, appointments committee, I will be sworn in, I will start my work. So that one, it is you who is worried, it's not me, I'm not worried. I am not worried, and I don't want to give attention to trivial issues. The authority for keeping me in his cabinet and for posting me to the Ministry of Health. I have just been vetted. We're now waiting for the results from the appointments committee. But what I can say, there is a lot of work to do in the Ministry of Health. And we are going to focus, first of all, on prevention and health promotion. Because when we examine the disease burden in Uganda, we have a combination of both communicable diseases and non-communicable diseases. Communicable diseases are diseases of underdevelopment and poverty, whereas the non-communicable diseases are diseases of lifestyle, diseases of affluence. So we have a combination, and both angles we're having a high rate in both areas. So we have to focus on preventive health care and health promotion, but also address the question of curative and rehabilitative services to ensure that we have adequate numbers of health workers at all levels, and we intend to recruit health workers, doctors, down to health center 3s in sub-counties, because the current policy of decentralization doesn't favor recruitment, because there are many medical schools that produce doctors and health workers, but they are not absorbed. They are on the street. They are running shops. We have to absorb them in a government system and deploy them to the health center 3s. And also ensure that we have adequate drugs and other pharmaceutical supplies. Ensure that when we budget adequately, but also supervise the management of these drugs so that leakages and thefts of drugs is greatly minimized or eliminated, so that we have enough drugs for the sick population in Uganda and many other areas. So we are going to revitalize and bring energy in the health sector and see to it that we address the health concerns of Ugandans. There's a lot of work to do. The work is well cut out for me as a minister, and I am ready to start with stamina, with vibe, and ensure that we address all these concerns, including ensuring that we have adequate infrastructure, hospitals in those districts which we don't have, and also to have health center 3s in all the sub-counties and have health center 4s in all the constituencies in Uganda, because a lot of work has been done, but there are still gaps. There are still sub-counties without health center 3s and districts without hospitals. Working with the Ministry of Finance and the wider government, we have to put adequate resources to ensure that health care is available for Ugandans. Starting this term with the outbreak of Ebola, and our appeal to all Ugandans is that we should all follow the standard operating procedures. We are going to intensify the campaign in terms of health education and explaining to the public the do's and don'ts, because Ebola is a disease which is well known. We have had about 8 outbreaks since 2000, and we know how to manage it. We know how to avoid it. Ebola is transmitted through contact with somebody who has the virus, either the fluids or body organs, and therefore we appeal to the public that the Ministry of Health has been issuing guidelines on how to avoid that risk of getting Ebola. Let's follow those guidelines, and we're going to intensify that campaign. But even those who develop symptoms and signs, and those who test positive, we are empowering and building capacity of our healthcare system to be able to manage all those cases. If you are identified as a contact that has been in touch with somebody who tests positive, we usually advise for you to get into isolation. Do not resist. So Ebola is a dangerous disease, but is manageable if all of us can comply with the measures which have been given out by health workers. We can be able to disrupt transmission, and then it doesn't escalate. But also we have to work with our neighboring countries, especially DRC, where the epicenter for this outbreak is. Already a decision has been taken to close the points of entry on the border between Uganda and DRC, but we have also to collaborate much more closely with the authorities in the DRC, because even if we do very well in Uganda and the problem remains in DRC and the cross-border movements are still on the high, then that will negate whatever efforts. So yes, we shall do as much as we can, but also ensure that we work with the authorities across the DRC and the other neighboring countries. So that is a regional effort if we are going to succeed in stamping out this problem of Ebola.
On the issue of interns, what is the solution? Medical interns?
Okay, intern doctors and nurses and pharmacists, if I can add, have been receiving allowances. Because internship means, like for a medical doctor, that you have completed the university, but before you can be fully registered to practice medicine, you undergo 1 year of apprenticeship or internship, where you are deployed in a hospital where there are consultants, and you work under consultants, under supervision, so that you can strengthen your clinical skills before you can be fully registered and left to practice medicine on your own alone. That is the practice. And in Uganda, we've been giving an allowance to keep these medical doctors. But I think what has come up is that there are now many training institutions and universities that produce doctors, for instance. And the question has been, now whom do you pay? Do you pay those who have been in the government universities? How about those who have been in the private universities? Because internship is not employment per se, but it's just a period when you are strengthening your clinical skills. The way lawyers go for LDC, so that they can become very competent in working as lawyers. So that discussion also has been the cabinet. I think it was arrived at that we consider internship as a continuation of training, because I think the numbers are also many given the many medical schools. And that now when you finish internship, that's when you can get into full employment as a qualified doctor. So it has its pros and cons. The policy has been passed, and we shall see how it will work, and we'll look at it as we get along.